Moving on to the next category, which is mental health and well-being. This award will focus on a team or service that has improved the quality of life for people with mental health problems, increased safety and/or promoted the well-being of the general population. The 3 nominations for this category are NHS Halton and St Helens with the Wellbeing Project CIC, NHS Blackpool with their project Primary and/or Intermediate Mental Health Services, Pennine Care NHS Foundation Trust and Streetwise 2000 Young Persons Service with their project With You in Mind. Let's have a look at these nominations.
The Ignite Your Life programme was commissioned by NHS Halton and St Helens. We were asked to develop and to deliver a series of interventions across the boroughs of Halton and St Helens. Basically, the events are about skilling up everyday people to stay resilient during difficult times. The event was also about being able to spot the signs and the symptoms of common mental health problems. So far, the Ignite Your Life Community Resilience Programme has been delivered to over 700 people across St Helens and Halton. During the event, we educated people about the 5 ways to well-being. These are 5 very simple things that people can do to improve their mental health: connect, be active, take notice, keep learning and give. And during the events, we invite all the participants to make pledges, a pledge for each of these 5 ways to well-being.
I attended a few of the Ignite Your Life events that were organised by the Wellbeing Project. It's about empowering people to find ways to look after their own mental health and well-being. Very simple ways that anybody, the average person in the street, can do. And it certainly made a difference to the way I felt when I attended the events, and also to the way that I work with people.
I've attended the Ignite Your Life event. It was really enjoyable, very strong messages, and I've applied it to my life, and it has really helped me through various crises that I've had recently in my personal life. The events were great fun to turn up to. They make the information really accessible, and people walked in a little bit anxious, a little bit unsure, not sure what to expect, and everybody walked out happy and with a huge smile on the face. It really is enjoyable delivery of a very serious message.
Well, 5 years ago in Blackpool, the mental health services that I manage were sort of put into place, really. And we were based a lot in community facilities. And everywhere, more or less everywhere that we went, places like children's centres, educational establishments, substance misuse services, people were saying to us, we need mental health providers in our service. So you'd have adults coming along with their children to nurseries or to Sure Start centres, and quite often those adults needed emotional support or had problems around sort of confidence building, low self-esteem, depression, stress, anxiety. What we've done here, we've got our Think Family roles, the parenting mental health professional, the family intervention mental health professional and the perinatal practitioner, plus our group work in a variety of community settings in Blackpool. Our aim is to have easy access to mental health services for children's services, and our main aim is to hopefully make a difference to the lives of those children whose adults are having a bit of a bad time at the moment.
I work within the Blackpool locality, so I work with any lady that has a Blackpool GP who's referred into our service, mental health services, having been identified with a mental health problem that has developed as a consequence of pregnancy or within the postnatal period. The role is specifically set up to help women around birth with mental health problems, as opposed to generic mental health, where you would have a generic mental health worker who works with men, women, any age group, any sort of mental health problem. It's specifically geared up for their needs and their problems.
The ultimate aim of having the Think Family roles is to make a difference to the children's lives. As mental health professionals, you often hear people saying, I could have told you that would have happened to that son, that daughter. What we're trying to do is prevent comments and statements like that in the future by making a difference. If their parents are happier emotionally, the children have a better chance.
I lived in the hostel with my 3 little boys. Because I became homeless, I was mentally depressed. Ended up in hospital after a really bad overdose. Ended up in the hostel, and then they put me on to Sure Start, and they just gave me all the support I needed, quite honest. I mean, they've got me from the depths back to going to college, studying criminology and sociology, whereas one time I wouldn't even get out of the house.
So the project's a combination of 3 things really, and the premise behind them is to try and find ways to continually provide young people with information around mental health and sort of social care needs that they may have. We have a website which is the online platform. We have a handbook which is hard copy, also available on our website, and we've used internet cards as an inexpensive and environmentally friendly way to draw people's attention to the actual website itself. The initial concept actually was from a voluntary sector agency that's in Bury, which is part of the footprint of our trust, called Streetwise, who developed a handbook. And in the back of that, one of our communications managers was also developing a website at the same time as part of a project that they were involved in. We have in the region of 6,000 young people within the Pennine Care footprint who are involved with our children and adolescent mental health services, and trying to get information across to that number of young people. We're constantly looking for new and different and innovative ways to sort of capture their attention. In terms of feedback with regards to our website, what we've done is we've taken that to a number of service user groups that we have established around Pennine Care. We road tested that with those young people before we went live with it on the internet. We also road tested the concept of the paper handbook and the internet cards. And the feedback that we got from the young people that we spoke to was extremely positive. We also took it to a number of established forums across the Pennine Care footprint, to safeguarding forums where we met with professionals and asked them to have a look at the concept and the idea behind it. And again, it tested extremely positively with them.
And the winner of the 2010 Mental Health and Wellbeing Award is NHS Halton and St Helens with the Wellbeing Project CIC. Well done to all involved.